Back at 9:16 now. Healthcare might be the single most engaging issue across the country right now. President Trump did promise a surprise on that front sometime this week, but until then, well, we're still left with a partisan divide on what to do, and even some disagreement amongst the Republicans as they try to repeal and replace the Affordable Care Act. Now, here to talk more about the problems here is Dr. Howard Selinger. He's the chair of family medicine at the Frank H. Netter, MD School of Medicine at Quinnipiac University. He is also a practicing family physician for ProHealth Physicians. Good to meet you, doctor.
Good to meet you.
Yeah, glad to have you here. We did a lot of talking beforehand because it's so easy to talk numbers and minutia and go right down the rabbit hole, where I think the problems between the two are much more basic and much more philosophical between Obamacare and whatever Republicans are trying to do.
And I would agree. I think the difference here is that is healthcare a business where tax cuts need to create efficiency, or is healthcare a right for every American citizen? And there seem to be two sides to this issue, and I think this is no less an ideologic clash than between North and South during the Civil War around slavery. It's that significant.
Yeah, because Obamacare, I think first and foremost, its goal is to try to get as many people covered as possible. Cost comes second because it's costly. Whereas on the Republican side, they want things to sort of follow Republican ideals a little more. Tax less, curb spending, deregulate wherever possible, and just give states choices. So given that that seems to be the goal, Doctor, how well do you think their two plans, both the House Republican plan and the Senate Republican plan, how well are they going to fulfill those goals of trying to save more money?
I think in the short term, you may see some costs come down, but in the long term, you cannot deny health care, avoid primary care services by people who choose, because of high premiums and high deductibles, not to be insured. Then those people are not going to get the primary care preventive services they need, which are the absolute bedrock of any developed country. And in that regard, you're going to see costs climb over time. You're going to see a return to uncompensated care, emergency room overcrowding, and people whose care and costs just need to be borne by others who are insured. These aren't just bad bills. These are ignorant bills. These are ignorant and cruel bills that'll put the burden on the older and the vulnerable and the indigent populations.
So you think they won't even save money, basically? Yeah. Well, you called it penny wise, pound foolish.
An ounce of prevention is worth a pound of cure. That's an American aphorism. We all believe it. And the Affordable Care Act was making progress in terms of lowering federal deficit, lowering medical bankruptcies, helping people to obtain preventive services, improving mental health. Had plenty of problems, although some of the rural insurance market problems were in fact triggered by the Republicans in not supporting the risk corridors that were originally promised through the Affordable Care Act. You can't expect a new program to be perfect right out of the gate, and it has been sabotaged. I think we need to go back to the drawing board. We need to recognize, as Paul Ryan said, that Obamacare may well remain the law of the land, and do what we can to shore up the insurance markets and continue the innovative primary care models designed to deliver better value, lower cost, greater access, and better quality.
And overlaying all of this is that even before the Affordable Care Act came in, we had a country where health care was just exorbitantly expensive. Between Obamacare or either of the other Republican plans, which one of those was most fit to try to address just that general problem?
I can only speak to the fact that, yes, Obamacare insured 22 million more people. No, it has not yet solved the problem of the expense. I think there is more innovation in the Affordable Care Act. In my own practice, we are challenged to deliver better value, to get away from the eat what you kill mentality where everything you do, you get paid for. Away from the mentality that when you drive down Route 84, you see UConn Health and Yale Health and Hartford Health, all advertising their centers of excellence, all trying to push to bring in more patients for more care to generate more revenue. We need to get away from healthcare as a business. We need to get away from MRIs costing $1,300 in this country and $300 in Switzerland, and ask ourselves why. Why are things so much more expensive here?
Yeah.
Why? Because we're a conflicted capitalistic society that we want people to have the freedom. We want corporations to have the freedom to do what they want to maximize their revenue, but we also want to be fair. We want to follow the American ideals of protecting our population, which is our greatest asset.
And there you have the basic divide. Should government play a big role in this, or should it be more free market? That's just something they're going to have to figure out. Unfortunately, it's not anything we have a lot of time to go into more depth with. Doctor, thank you so much for joining us today to give us your input. Let's see if we can get you back as we start to learn more about these bills as they take shape to judge them that way. Thank you so much.
Glad to be here.
Okay, well, still ahead on Fox 61's Good Day Connecticut. If you're looking for something to do this weekend inside, Foxwoods may grab your excitement.